Hello, my name is Adrienne Johnson, and I'm going to do a verbal vaginal insertion demonstration. Knocking on the client's room after looking at her MAR, checking to make sure she is who she is that's on her MAR. I introduce myself to her and tell her that I'm there to give her her vaginal insertion. I wash my hands. I have my vaginal insertion. I have the tube and I also have the lubricant. I have my gloves on. As I walk to the client, I put her knees up and I spread her legs as she's laying on her back. I go back to the vaginal insert. I take it out of the foil and I still have my gloves on. I take it out of the foil. I put it in the tube. I put lubricant on it and then I put it in the tube and then I put lubricant on the tube also. I walk to the client and I explain to her what I'm going to do again. And I take my non-dominant hand and I spread her labia. And with my dominant hand, I put the tube in her vagina and I release it. I pull the tube out. I cover her for privacy and I tell her to lay there for about 5 minutes or 10 minutes. I take the tube, since it's her vaginal tubing, and if it is hers and it can be reused again, I take it to the sink and I clean it good. I take off my gloves. I get rid of everything else. I take off my gloves and I wash my hands. I walk over to my MAR and I check off to say that I did give it to her.